Your passcode has been confirmed. If you need technical assistance during your call, press *0.
After the tone, please state your name, followed by the pound sign. I'm sorry, we did not get your name. After the tone, please state your name, followed by the pound sign. I'm sorry, we did not get your name. After the tone, please state your name, followed by the pound sign. This conference is in silent mode. There are 30
parties in conference, including you.
We're presenting another in our ongoing series of webinars on point-of-sale initiatives. In the past, we've done quite a few webinars that have looked at specific aspects of point-of-sale policy issues and taken more of a technical approach. Today, we're going to try to focus more on the campaign planning aspects of point-of-sale work, and specifically on laying the foundation for creating public education campaigns to bolster and support point-of-sale initiatives. We have a panel of people with us today from the Center for Tobacco Policy and Organizing out in California. 3 presenters, Kimberly Amazine, Lindsey Freitas, and Erin Reynoso. We also have Christian Stumpf with us, who is a Regional Director of Public Policy for the American Lung Association in several southwestern states. So before we introduce our panel, the audience is growing as I speak, so we'll run through some housekeeping measures and see if we can't get up to our maximum number by the time the presentation starts. All of your lines have been placed on mute. The presenters certainly can unmute themselves by pressing *6 when they're ready to present. We're going to use the Q&A function at the top of your screen. If you want to pose a question to any of the presenters, please access that Q&A function at the top and put in your question. I'll present them to the panelists at the end of the presentations. And if I do misstate in any way your question, or if you think you need to embellish it or fill in any of the blanks, by all means feel free to unmute yourself with *6, but I'll try to deliver the questions as posed on the Q&A function. We will be getting the slides out to the list of attendees after the meeting, and this meeting is being recorded. Let me just run through the panelists one more time, and then I'll turn it over to them. Their contact information is on the next screen. So again, the 3 individuals from the Center for Tobacco Policy and Organizing, Kimberly Amazine, Lindsey Freitas, and Erin Reynoso, and also they're joined by Christian Stumpf from the American Lung Association. Looks like we have an error on Christian's information. He's now with the Louisiana Public Health Institute, but we'll correct that information on the information that we send out after the presentation. I just want to sort of preface the presentation by letting folks know that here at OSH we've had recent conversations with folks in several states, Louisiana, Pennsylvania, Kansas, Maryland, New Mexico, among others, where there is some very, very careful and thoughtful planning and discussions going on regarding point-of-sale work. That's sort of the emphasis of today's webinar. We're really trying to dial it back a little bit and get people to appreciate the need to think carefully and plot out their course deliberatively and to begin at the beginning, which is laying a good public education foundation for the work that you're contemplating. So with that, I'll turn it over to Kimberly Amazine, and Kimberly, just remember to press *6 to unmute yourself.
All right. Thank you very much, Jerry. Want to make sure you can all hear me before I get going.
I can certainly hear you.
Okay, good. Good. Well, good morning, and it's such a pleasure to be here. My name is Kimberly Amazine. I'm Vice President for Programs and Advocacy with the American Lung Association in California, here with my colleagues Erin and Lindsey, and certainly it's a pleasure also to have Christian, my counterpart and colleague based out of Arizona, also participating today. I want to give you and provide a brief overview of our work here in California, only for context. Some of you may know us. Some of you may know us as the Center for Tobacco Policy and Organizing, but we are a project of the American Lung Association in California. And I've been with the Lung Association 8 years and had the pleasure to be the director at one point, and there is a phenomenally robust team of experts now running this center, all of whom I have the privilege of working with. We are funded primarily through the California Department of Public Health Tobacco Control Program, and it's worth noting that our California Department of Public Health has made tobacco retailer licensing a priority, which has allowed us to do this work, to grow our work, and to expand policies both statewide and locally. And it really is the cornerstone of why we've been so successful in California. So a quick overview for those of you who are not aware of our work. And I'm going to frame this in a way that you might start to be thinking about how to frame it in your state. The fact is, Big Tobacco spends about 10 times marketing here in the state of California than we spend on tobacco prevention. And in response to this ongoing challenge, the American Lung Association over 10 years ago founded the Center for Tobacco Policy and Organizing to ensure that local advocates from all across the state have skills, resources, information, all to be successful in protecting their neighbors and their communities and their residents from the harmful effects of tobacco use. So the center has brought together tobacco control policy expertise, campaign consulting proficiency, and community organizing skills that help provide California's tobacco control movement with those resources, with tools and effective strategies to build political capital and achieve policy success. Not only do we receive funding from the California Department of Public Health, but we also receive funding from the Public Health Institute and the County of Los Angeles. And all of this is to build up the skill set of communities and coalitions around the state to really be able to protect their residents from the harmful effects of tobacco use. So one of the ways that we at the Center and the Lung Association measure our success is by the success of a lot of local campaigns that are led by these coalitions. We guide community activists, the volunteers, the staff in developing knowledge and skills to educate policymakers. And I note to all of you on the phone today to educate, to provide vital information. You are all the experts. Everybody throughout the states locally have expertise that is available to decision makers, and we need to be sharing that information. And that's the way then you start to activate on those local policy campaigns and organize community coalitions to win. So we've been winning a lot here in California, and over the past 10 years, we've passed hundreds of smoke-free housing laws, outdoor area laws, and tobacco retailer licensing ordinances. So trainings and troubleshooting calls and local websites and in-depth policy documents have all contributed to this broad success. And let me say to all of you on the phone, it's a collective success. We can't do this without a tremendous amount of collaboration with partners both locally and statewide. Some of whom you're aware of, a significant partner of ours is Change Lab Solutions. Many of you know. They provide vital technical information as it relates to the law. So we do everything from tailored presentations, and while we focus primarily in California, we have had the pleasure of working in other states, other select states, and we'll be able to continue that practice as time will allow us to provide technical assistance and resources to other states. So let me paint the picture a little bit about California. Are we moving the slide? All right, there we go. Actually, let me go back, I'm sorry, and introduce now Christian Stumpf. Or am I giving this back over to you, Jerry? Sorry about that. All right, Christian, sorry.
Bring it in.
Okay. Sorry. So before we go and paint the picture for California quickly on tobacco retail licensing, one of the aspects of this work that's vital to all of you on the phone is that Christian Stumpf is doing a lot of work to advance and really kind of prioritize tobacco retail licensing in other states. So we want to kind of paint the picture a little bit more broadly than California. So let me now turn it over to Christian.
Thanks, Kimberly. Can you all hear me?
Yes.
Okay, thanks. The Southwest region for the ALA happens to have 3 states that don't have any type of, well, I should say, don't have statewide retailer licensing laws in Colorado, Arizona, and New Mexico. So I think New Mexico is in preliminary discussions about moving forward with some local licensing ordinances. Colorado has moved forward with some local licensing ordinances, and I want to talk about Arizona for a little bit, just because that's where I'm based, and we've made some progress so far. And Arizona's kind of unique. We really don't have any kind of chance politically to pass a statewide licensing ordinance at this time. So we're going ahead with local ordinances for 3. We've picked 3 different communities in the state, and we're going to work to get something passed at the city and county levels. And this was kind of brought to our attention by a study that we did through the University of Arizona that indicated the state was losing between 80 and 100 million in tax revenue due to counterfeit and untaxed cigarette packs. So that was a big concern for us, and that was along with the state information on youth purchase rates during sting operations. We knew that there was a problem that we needed to move forward with and solve. So what we've done is there's no public money available for our campaign, so we went out and found some private funding through a foundation, which has allowed us to hire a consultant locally who kind of knows the lay of the land of the city that we're working on currently, and so we've been working with city and county officials to get something up and moving. It's been slow, and like Jerry had mentioned, we're taking a slow and deliberate approach to make sure that there aren't any surprises when we end up going to council. So just again, I mean, we really wanted to get something done. We so much so that we went out and sought private funding to do this. So with that, I'd be happy to answer any questions after everyone's done.
Thank you.
All right. Thank you, Christian. Now I'll give you a quick overview of California. And listen, having lived outside of California for just a little bit in D.C., I know everybody says, but we're not like California. So what we want to do is just paint a quick picture so that it allows you to frame for your state how to best set your state up to execute however you can. What's possible is dependent on some resources like money, but it's also dependent on other tools and on-the-ground opportunities and advocates that will come your way. So for California, the way that we've kind of assessed tobacco retailer licensing and the way that it's played out here is that we both have a state law that requires a license to sell tobacco products. So some of you in other states might have that. But the law is not really designed to address public health concerns like youth access to tobacco products, which we're all very concerned about. Our state law is a one-time fee only, and that is a problem. So what we've been able to do, working with advocates around the state, is to effectively create the synergy between a state law that does one thing that really kind of is there to address smuggling on a higher level and complement it with the public health kind of aspects that really will keep kids from ever starting to smoke. So the way communities have been throughout California attempted to fill the void of this is to adopt local tobacco retailer licensing ordinances. You're going to hear from Lindsey how many have done that and to what extent some of the tools that we've used that help provide kind of for advocates across the state a statewide landscape of being able to leverage what's worked in one city versus another city. But the most important thing that we believe when it comes to tobacco retailer licensing is that you've got to put some teeth in it. You've got to look at suspension, revocation when a retailer violates a law, and you also need to look at putting in money towards enforcement. And those are key aspects at the local level that have complemented our state law. Licenses are one way to ensure that there's compliance with local business standards, to reduce youth access to tobacco, and to limit, let's not forget, limit the negative public health effects that are associated with tobacco use. So throughout the state, ordinances have evolved very differently, but the ultimate goal is to hold retailers accountable for those violations of tobacco sales laws. And cities and counties throughout the state have been able to adopt and enforce several different laws to regulate tobacco retailers. So what you're about to hear is a variety of tools that are designed to help communities understand the drawbacks, some of the advantages of each law, so that advocates can better evaluate the right solution for their community. State and local governments are increasingly looking for ways to limit and prohibit the sale of tobacco products to minors. So these resources that we're about to run through can be offered to you with different options, and they outline key considerations for advocates and community leaders and state health department leaders. The Center has developed a lot of these resources based on what's worked here in California. ChangeLab Solutions has developed model ordinance language to help cities and counties that want to require tobacco retailer licensing. And today you're going to hear a little bit more from both Lindsey and Erin about these essential elements. Bottom line is this: tobacco retailer licensing is a strong strategy for public health. And the goal of the course of the next 30 minutes or so is to get you thinking about what's applicable for your state and your local government and your local communities. I'm going to kick it over to Erin now. Lindsey.
Great. Thank you, Kimberly. So you've heard Kimberly talk a little bit about tobacco retailer licensing, but I want to give you a little bit of background about exactly what it is. So as she mentioned, here in California, how we've addressed the retail environment is through what we call the tobacco retailer license, or a TRL. And this is a license required by local governments in order to sell tobacco products at the local level. It is on top of the statewide license that Kimberly mentioned, and it really provides a way for local jurisdictions to enforce local, state, and federal laws and to ensure that children are not able to access tobacco. So I'm going to talk a little bit now about the components of this ordinance, and this is what we've learned in California to really be key to being successful. So one of the key things is that this is a license that has to be renewed annually and have a sufficient fee. And the fee is kind of the crux of the entire thing, because this fee is what provides resources for the local community to go out and provide enforcement of the retailer license. So it's what provides funding to whatever enforcement agency you decide to utilize. And, it really helps when cities are kind of cash-strapped and don't have the funding to do that. This is how a lot of communities do their youth purchase surveys, and this is really the key part of it, is having a sufficient fee. Some communities have devoted other funding sources that they receive, either a portion of their general fund. Sometimes communities have MSA funds they've been able to put towards it, and that's worked fairly well, but you always have to be vigilant when you have those types of funding sources, because those are a lot easier to take away than if you had a sufficient fee that had funding dedicated to administration and enforcement. The other key of these policies that we found is that it is a violation of the license to violate any local, state, or federal law. So what this means is that if a local retailer violates the FDA law, then they lose their license or go through the series of deterrents and penalties that they would go through. So it really gives local governments teeth to enforce some of these statewide and federal laws that they may have difficulty enforcing otherwise. I kind of touched on it already, but another important aspect is having fines and penalties. So these fines and penalties oftentimes go hand in hand, and they increase as the number of offenses increase. They can include suspensions or revocations along with fines. So you could have some $100 fine and a 30-day suspension with the first violation, and a $300 fine and a 60-day suspension with the third violation, and so on and so forth, ultimately resulting in a revocation of the license if it reaches that point. And another thing that we've recently discovered to be incredibly important with these is having a broad definition of tobacco product. And this means that you have a definition that can capture any potential tobacco product that might potentially pop up. And the Change Lab Solution model definition is a really great resource for that. And we've just recently learned here in California how important this is with a new product that we've recently discovered called Sigafizz, which is essentially nicotine pop rocks. And one of the communities that it popped up in had a really strong, broad definition of tobacco product, and so their tobacco retailer license covered this new product. There's another community that it popped up in that didn't have a broad definition, and so now they're struggling to figure out what they can do about that product. So that's an example of why a broad definition is really important. So aside from those key parts of what makes a really successful policy, there are a bunch of other things that we refer to as plugins, or additional policies that can be plugged in or added to your policy to strengthen it. And you can see some examples here. Sampling, which would make it a violation of the license to provide free or nominal cost products. Minimum pack size, so retailers would be required to only sell products with how you specify that. You can prohibit a license from being given to places that serve food or beverage for consumption on premises, so then a restaurant or a bar would not be able to access the license. You can also limit the location that the licenses are given depending on the location or proximity to each other, the number of retailers in the area, or the location and proximity to a school, which we've seen a lot of here in California. And also drug paraphernalia, which if a store were selling drug paraphernalia, they would be in violation of the license. These tools are really key when you are going through the process of planning out your strategy for what you're going to do. Understanding these little pieces are going to help you gain or lose support, and they're really helpful in messaging this policy, and we've seen that happen throughout the state. For instance, the drug paraphernalia plugin is very popular in the more rural areas where there's a larger drug problem, and so communities have used that as a tool to increase the support for these types of ordinances. To note, not all of these have to be done through a tobacco retailer license. A lot of these can be done standalone, specifically sampling or density. Sometimes communities will prohibit sales near schools through their zoning code. So there are other ways to go about this, but these are just some examples. There are other plugins as well. So now that I've talked a little bit about what the bits and pieces of the policy are, let's take a second to look just a little bit at the numbers in California. So in California, we have 111 strong ordinances. So these are ordinances that have a strong fee. They prohibit violations of federal and state law. They are required, they have penalties, they have fees. These are all strong policies. They've been adopted in 19 different counties in California, both in rural areas and urban areas. And we have policies in cities that have populations as small as 3,000 or as large as 3 million. So these policies vary greatly throughout the state and address the needs of all different kinds of communities. The fees range between $30 for some of the smaller cities that maybe only have 1 or 2 retailers to the $665 for a city that has a lot more. Typically we see there's the fee between $200 and $350, and that's usually adequate to cover the cost of enforcement like we've mentioned. We also have 17 rural communities in California that have adopted TRL, and that's notable because these are communities that we wouldn't typically see pursuing these types of policies, and they've been incredibly successful there. And one of our interests was how do we know how successful it's going to be in these rural communities? So we did a poll of the rural communities in California on the tobacco retailer licensing to get a little bit more information and to provide some information for these rural communities as they pursue these policies. And this is what we found. 50% of rural residents think it's easy for youth to purchase tobacco. So 50%, half of the people living in these rural communities thought that their kid could just walk to a store and purchase tobacco without any problem. And that's a big deal, and that lends to this 78% support for these license requirements. So there's strong support for retail licensing in the rural communities. There's also 91% of people agree that a store owner who repeatedly violates the law should no longer have the right to sell cigarettes. So there's strong support for the policy, and there's also strong support for enforcing the policy, and the enforcement is really key in these types of policies. So we can see that these numbers help build a strong case for us to take as we're working through the process of passing and implementing these policies. And understanding all these specifics, the numbers, the details in your policy, that's all going to help as you go through the whole process, which Erin is actually going to talk about next.
Yes, thanks, Lindsey. All right, so now I'm going to talk about the phases of a policy campaign. But before we do that, I really wanted to talk about why we do policy in general, sort of whether it's tobacco retail licensing, workplaces, or housing. And the fundamental belief with the desire to work on policy is not because it's fun, it's because the status quo is the way it is because it benefits those with power in our society. If the outcomes we desire were beneficial to those in power, we would already have them. That's why things like women's rights, African American rights, child labor laws had to be policy changes. Because if we relied on voluntary policies, there'd be no kids working in some factories and kids working in others. Because for some factory owners, having kids work for them would be beneficial, and they'd never change it voluntarily. So those with power on our issue, the retailers, the council members, they're not going to just give us the power to do what we want because we give them a nice presentation. They're persuaded by power, and that means that you need to build that power. Which is why even if you lose or you have to compromise on a policy effort, you've been successful. Aside from policy change itself, you've been able to build power, you've been able to build influence, and you've changed the discussion in your community. So now the best way to build power is to go about it strategically. And so today we're going to talk to you about our main community organizing model and some of the tools that can be utilized with it. So the phase model is something we developed after many years of working on policy in California. And this tool lays out a path to help you really guide you through the campaign process. And in each campaign, we say that there are 5 phases. So the preliminary investigation and assessment, strategy and planning, recruitment, the campaign itself, and implementation and evaluation. So there are a lot of details in each of these phases that I'm going to go into in just a minute, but the most important thing to note is that these phases should be done in order. is we created these phases after we discovered that really people were just skipping right to phase 4, right to the fun stuff, I like to say, the letter writing, the meeting with elected officials, the media, and bypassing all of the important phases ahead of it. And those phases 1 through 3 are incredibly important. So getting your ducks in a row, getting yourself and your community ready before you just jump into a campaign is really important. So let's dig a little bit deeper into the phases. Phase 1 is the investigation and assessment phase. The purpose of this is fairly clear in the title, and this is a phase where you're going to do all of your research. And it's really important to do this research right off the bat to help solidify your policy goals, to help solidify which specific city or county you're going to be working in so that you know who the targets of your efforts are. So you're really going to be researching the elected officials, your political environment, the issues in your community, and any possible allies that might help you. The activities that you'll be doing in this phase will be assessing the political environment, so meaning identifying local problems, local issues, and resources that might impact your campaign, gathering public health data, and understanding any other factors that might influence decision makers in the community that you're working in. You're also going to be conducting informal interviews with a number of people, so you'll be talking to people within your office, within your coalition, within your community, about any past experiences that they've had with this issue or a similar issue. And this also sort of has the added benefit of being a low-key way to start gathering support for your issue. Now, we use a couple of different tools, especially in this section, and the first one is the elected official profile form. And this just sort of asks you several different types of questions in regards to your decision makers to help you gather that background information on them. And then assessing the political environment checklist does something similar for the actual community that you'll be working in. So how does the local government work? What is sort of the background of the city or county that you're working in? Things like that. And really the more information that you can get and the more research that you can do on the community and the decision makers you'll be working with, the better advantage that you'll have to the rest of the phases of your campaign. So phase 2, strategy and planning. So this is when you take all that research and information that you just gathered into one and start applying it to form a roadmap for your campaign. And there are 3 tools that we like to utilize in this phase. And now while all 3 of these tools can technically be done by staff, it's really, really important that all of these tools are done with members of the community that you're going to be working in. I mean, after all, they're the ones that are living and working in that community day to day. They're the ones that are going to be most impacted by your policy. So you want to make sure that you have their buy-in. And they're also the ones that really just know this information. So the first one to talk about is the strategy chart. And this is the tool that will help you create a rough timeline for your campaign. This is where you're going to map out your assets, what you need, what allies you have, what tactics you might use to influence your decision makers, things like that. The next one is the decision maker matrix, and this takes that elected official profile form that you filled out earlier, all of the information that your community members have, and you put this into the chart and it helps you determine who might be your champion and who your targets are. And the final tool we use here is the circles of influence, and this really helps you determine the connections that you have in a community. It also really is a great visual to help you visualize the connections you have in a community. And so we use the circles of influence in the decision maker matrix along with the strategy chart to really help flesh out all of the ideas and all of the strategies. And again, it's really essential that you do this with the community members and face-to-face. That's really the key to phase 2, is doing these things with the community members. All right, phase 3, building your base of support. So before contacting elected officials, before going to the media, before doing any sort of tactics, it's really time to reach out beyond your core supporters and involve more people in your effort. And we really like to call this the missing link, because you cannot execute your tactics effectively without having the right people, the people that actually have the power in your community, without having them involved. So in this phase, you're going to need to be doing all the sort of activities to recruit new members to your coalition. So you're going to be getting to know your community members and groups and leaders, and you really overall just need to become more connected with the community. So the activities that you're going to be doing, they're all aimed along recruiting new supporters. So you're going to be training your core group of supporters, to do one-on-one meetings with key community leaders. You're going to be making presentations to organizations, having one-on-one meetings with prospective new coalition members, and attending community events. Now, all of these recruitment efforts aren't going to guarantee you a huge, amazing new coalition, but it's definitely going to help you identify people with the right skills and the right contacts that will help you with specific tasks later on in your campaign. So this phase can really take a lot of time, but it will pay off in the end. It's really important to gather these, the appropriate coalition members in this phase. They all lead to phase 4, which is the campaign itself. And this is the phase where you get to implement, like I said, what I think are all the fun sort of things, the activities and tactics that you laid out in your strategy that were designed to influence your decision makers. So the two most important things to take away from this phase are that all activities are focused on your tactics, and all tactics are what you and your allies do to your targets to reach your goal. So this phase, you're going to want to revisit that strategy chart that you did back in phase 2 so that you know what you want to carry out, who's going to carry out that tactic, and who that tactic is designed to target. And you're going to want to make sure that you review this and make sure that all of these tactics are still compatible with any new coalition members that you've gained since phase 2. And this is really why your success in phase 3 will pay off, because you need the local residents and groups and the people who have influence over decision makers to give presentations, write letters, and become familiar enough with the ordinance to really talk about it with authority. Phase 5 is your final phase, implementation and evaluation. So you passed your policy, you're celebrating, now what? So a lot of times we see that folks forget about phase 5. They're so excited that they've passed this policy, they put in so much time and effort, it's such a victory that they sort of forget that it's really important to make sure that it's implemented effectively. So there are 5 elements to successful implementation. I want to research how that policy should be implemented. So looking at other cities, counties, states that have done similar things and seeing how they've implemented their policy and how it's been successful. You want to renew relationships with elected officials and staff. You want to make sure that you're saying thank you to these folks that have actually helped you pass this policy. You want to make sure that that relationship continues to grow. You want to develop relationships with staff involved in implementation. In case there's an issue, you want to make sure that you have the right connections to help you resolve that issue when it comes to implementation. You're going to enlist the public as an ally. Oftentimes, smoke-free policies are, half the enforcement is within the public. You want to make sure that they're educated on the policy that's passed and let them know how they can help make sure that it's being implemented. And then lastly, you want to evaluate the effectiveness. After you've done all this work, you want to be able to step back 6 months, a year later, and take a look at the policy and make sure it's being effective. And this phase is particularly important with tobacco retail licensing because you want to make sure that your fines are being enforced, that stings are happening, and that if they're not, you want to make sure that you have the right relationships in place to get them enforced. Otherwise, all that work that you've done in those 4 other phases are for nothing. And you know, not only do you want this policy to be successful to help reduce youth access to tobacco, but you also want to show a policy success in that community. You want to show the community members that you've been successful, that they've been successful in passing this policy. And you also want to show the decision makers that policies like this can work in their community so that the next time you approach them with a similar policy or another smoke-free policy, they're going to know that this type of policy can work in their community. So it's important to show these policy successes. So that's the final phase of the campaign. And again, just to remember, it's really important to think about these and do these in order. So I hope that you guys can take this information and you'll go back to your coalitions and your community members and sort of map out your next steps and figure out the different phases to your campaign and how they align with the 5 phases of a campaign itself. And all of the tools that I mentioned, and I know all of the information that Lindsey referenced, are available on our website, which is the Center for the number 4 tobaccopolicy.org. So you can find all kinds of documents there and download them for you. And there's also all of our email addresses listed here. So if you guys run into a question or need a document and you just can't find it, feel free to shoot us an email and we'll help you with whatever we can. So I'll shoot it back to Jerry, and if there are any questions.
Thank you, Erin. We actually don't have any questions posted yet, but I have a couple of my own. I'm curious because one of the things that is so clear from your presentation is that the center works very closely with Change Labs out in California. And so advocates in California on point of sale have these two very significant resources right within their own state. And in addition to the center and Change Labs, they also have a network, obviously, of advocates around the state. If you're doing local licensing work in one part of California, you probably don't have to look too far in any direction to find someone else who's done it one or two towns away. And unfortunately, we don't really have that same mix of support in place in a lot of places around the country. We have enormous resources from the Tobacco Control Legal Consortium and from countertobacco.org and some other supports that are developing and in place. But there really isn't another state, I think, that has right within its boundaries the kind of resources that you've talked about today. So if you could just, any of you, talk a little bit about how best for folks, in the middle of the country, in the Midwest, in the South, or anywhere in some states with less resources, how can they best utilize the supports that are there and hopefully expand some of those resources and make use of them right back at home?
Well, I mean, I think, you're right. You have to start somewhere. And I think that the biggest thing to do when you're starting off in any state, in any community, is really getting the community members on board. I mean, they are your number one asset, more so than, Change Lab Solutions or the Center for Tobacco Policy and Organizing. The bottom line is that these policies wouldn't pass if there weren't community members involved. They're the ones with the power in these communities, and it's really important that you mobilize them, get them invested, and prove to them why this is an important issue in your community so that they can go to city council or, any county board of supervisors, anything like that, and approach them and show them and demonstrate that there is the power and the will in the community to make these things happen. I really think that's your number one asset. It's great to have the research from different organizations and to have other policies to reference, and California is very lucky that now we have many policies to reference. But it still started with one tobacco retail license policy, and it came from community members getting together and going to their council and saying that this is something that they wanted to have happen. And that's really how all sort of grassroots, activities happen, is they start right there and they build that power and demonstrate that power to council.
And this is Kimberly. I'll jump in. That was Erin. One thing for this group is there has to be concerted effort to prioritize. There's so many different policy options available in other states to pursue, and I find still that we can be in a position of playing beehive soccer, where I feel like we're all following the ball wherever the ball goes and we're not staying in our position. And so if you decide to prioritize this, other things may come up. It might have to adjust your priorities. But oftentimes, some of the coalitions we work with have decided to make this a priority based on a community assessment. That doesn't mean other issues arise, but it means that they're going to stay focused on this goal. So to the extent that other products come into play, like electronic cigarettes, we're seeing a lot of reactionary type of actions being taken by community members and also policymakers, decision makers at the local level. All of a sudden they see e-cigarettes and everybody wants to do something about e-cigarettes. Well, guess what? If you have a strong tobacco retailer license law in place that defines a tobacco product broadly, then your e-cigarette problem is taken care of. So it's really about setting the foundation for a strategy and then sticking with it. So some of your state health departments with limited resources have to determine that this is a priority.
And Kimberly, I think you did mention that the center has been able to work in some other states outside of California recently?
I'll let Erin answer that. Yes, we have.
We have. I know that we went to South Bend, Indiana, not too long ago, believe in the winter, and we worked with them on some workplace policies, did a strategy chart for them. I know that Vanessa, who is actually not here today with us, but she also went to Arizona or New Mexico and worked with them on some strategy charts and things like that, helping work through the policy process and the campaign strategy process. So yes, definitely.
Jerry, this is Asha. Are you not seeing the questions on the Q&A?
Not on my screen, no.
Okay, well, I'll just read them out for you.
Okay.
One says, I didn't catch the new product name. Was it Sigafizz?
Yeah, it was Sigafizz.
Okay. The next one says,
nicotine pop rocks. Yeah.
The next one says, you mentioned inclusion of violation of state and federal laws in your tobacco licensing. As a violation of your licensing law or code, are you thinking any state and federal laws or just state and federal tobacco laws?
State and federal tobacco laws are a violation of the license, yeah.
Okay. The next question is, the speaker just mentioned a new tobacco product, but I couldn't catch the term. Was it tobacco lock?
That's the Sigafizz again.
Okay. Yep. And how do you deal with the influence of the tobacco industry as you are working at the local level? How do they complicate or interfere with your campaigns?
The retail environment is probably one of the areas where the tobacco industry is the most active at the local level, but they're not active through their corporate entities. They're active through other groups, through groups like the Neighborhood Market Association, which used to be called something Grocers Association, and through groups like NATO, the National Association of Tobacco Outlets. So these are some of the groups we're seeing come out and kind of rally retailers against these types of policies. At the end of the day, they make a lot of money off of tobacco products, and we do have resources for all of this on our website. So we have gone through the NACS report, the National Association of Convenience Stores report, which kind of itemizes all of the revenue they generate from all their different products, and we've kind of pulled out the tobacco parts. And you can see there, on average, nationwide, what a convenience store makes on tobacco products. So these fees are not outrageous when compared to the hundreds of thousands of dollars they're making on these products. We also have some talking points to address some of the major counterclaims we get for these policies from the Neighborhood Market Association and from NATO. So check it out. They're really great tools, and I think they could be very useful in any place. So.
And that document is called?
There's three of them I'm talking about. So there's one that's called the Neighborhood Market Association and Tobacco Retailer Outlets. There's one that's called the National Association of Tobacco Outlets and Tobacco Retailer Licensing, and then there's Cigarettes Generate Big Revenue. So those three documents are all available on our the Center for Tobacco Policy website under Retail Environment.
There's also a document called Becoming a Policy Wonk, which helps you answer tricky questions or tough questions about any particular policy issue. This one for tobacco retail licensing. So that's available on the website as well. Again, a lot of the answers have to do with California, but I think you can take them and take some of the data that Lindsey just referenced in those other documents and help answer the question for your specific state. Yep.
And the last thing that has been posted is a comment that says there are some photos of cig on countertobacco.org's gallery, if you're interested in taking a look at those.
Great, thank you.
Erin, I just want to go back to a comment you made. I certainly agree with you that the first thing you have to worry about is establishing community support for any kind of policy change. And I think in point of sale, the biggest challenge for the movement collectively is that, you know, on other tobacco issues like smoke-free environments and higher excise taxes, the education foundation has been laid down very carefully and over a long period of time, and I think all of us benefit from that educational base that's in place. It doesn't seem to be in place as much on point of sale. I think a lot of communities that are trying to deal with this issue are first confronted with the problem that the public at large, certainly policymakers in the media as well, don't even perceive that there is much of a problem. And I guess I'm wondering, in California, as the movement has gone from county to county or city to city and all of these ordinances have been passed, has there been a need in each place to do that kind of education, or is there becoming a cumulative effect so that as newer counties and cities come on board, they're riding on the shoulders of the other folks that have already passed these policies?
Well, I would say that no matter what community you're working in, even if you're working in a community in California, there is an education element that has to happen with the community. I think you're right. A lot of times people don't see it. It doesn't happen right in front of their face, so they don't realize that there's a problem. So, you know, it takes surveys and it takes what we call key informant interviews, talking to community members about the issue, surveying stores, you know, different types of youth purchase surveys, things like that, to sort of collect the data and then make the data public so that the community members know. I think that there's always that element in the communities in California. What we're really lucky to have is that we can take, you know, once we've educated the community, rallied the troops, gotten them on board, and we're sitting in front of councils, that we can take some data and some ordinances from neighboring similar communities and say, you know, here's what they've done. That's, you know, one advantage that we have. But the first step is they still have to get the community members on board, and they don't just buy it immediately. We still struggle every day in California to pass tobacco policy, you know, tobacco control policies. I mean, we've been struggling for a few years to pass a tobacco tax, so it's still definitely a problem in California, and it's a problem not only, you know, passing the policy, but it's also a problem just making sure that the community is aware of the problem. So.
And sometimes kids are your best messengers. And to that extent, when you're looking at a community, whether it's a county, a region, you know, a state, recognizing that you don't need polling to know, and I think anybody who's done polling will tell you the number one thing, whether it doesn't matter if you're a smoker, a non-smoker, a politician, a regular voter, nobody wants to see kids starting to smoke. And so an extension of that is nobody really wants to see kids have access, underage kids have access to tobacco products. So, you know, you don't need a lot of resources to know that you're going to get public support on that, but you have to show that there is a need for a policy. And from that perspective, youth are your best messengers, sometimes with decision makers, to really lay out the problem.
We just have a few minutes left. I apologize for the glitch on my end with the Q&A function, but if there's anybody on the line that would like to pose a question verbally, just hit *6 and unmute yourself. And if we don't have any questions coming in, I would just remind you all we'll get the slides out to those on the call today. We'll have Christian Stumpf's contact information corrected. I think the folks from the center have all welcomed your follow-up emails and phone calls. If you have any information you'd like to get from them or follow up with them on things that they've said, as they've indicated throughout their presentation, their website is very valuable. And I think in general, although they are a primarily California-based entity, they really do add to the mix of national TA supports that we have for point of sale, from counter tobacco to the legal consortium to the resources in California that we've heard about today. If there are no questions from the field or any final comments from the presenters, I think we'll wrap up today's session. Thank you.
Thanks so much, Jerry. Thanks, everybody.
Thank you.
Thank you. Have a great day.
The leader has disconnected. This call will now end.